Have you ever wondered how IV cannulation is done? Intravenous cannulation, or the insertion of a cannula into a vein, is a vital medical procedure used to administer medications, fluids, and even draw blood samples. It's a skill that every healthcare professional should master. Firstly, it's crucial to understand the veins that are commonly used for this procedure. These include the veins in the hand and forearm, such as the median cubital vein or the cephalic vein. Understanding the anatomy of these veins and their locations is paramount for successful cannulation. Before starting, preparation is key. This includes having the right equipment, such as different types of cannulas, catheters, and other necessary items. It's also important to assess the patient, considering factors like their age, overall health, and specific needs. Maintaining a sterile environment is non-negotiable. The use of an aseptic technique helps to minimize the risk of infections. This involves the use of gloves, sterilizing the skin, and using sterile equipment. Now, onto the insertion techniques. These can vary depending on the patient's veins and their comfort. However, the basic technique involves inserting the needle at an angle, then slowly lowering the angle as the needle advances. Even with the best techniques, complications can occur. These might include difficulty finding a suitable vein or the patient experiencing discomfort. It's crucial to know how to troubleshoot these issues and ensure the patient's safety. After the cannula is inserted, proper post-cannulation care is essential. This includes securing the cannula to prevent it from moving, monitoring the site for complications, and educating the patient about what to expect. Finally, we'll walk you through a hands-on demonstration of IV cannulation to reinforce everything covered today. To recap, we've explored the importance of understanding vein anatomy, the need for thorough preparation and patient assessment, the importance of sterilization and aseptic technique, different insertion techniques, handling complications, and providing post-cannulation care. Remember, confidence in IV cannulation comes with experience. So keep practicing and refining your techniques. Don't forget to subscribe, like, and hit the notification bell for more healthcare tutorials. Together we can master the art of IV cannulation.